Hi, this is Dr. Rodger Murphree, yourfibrodoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. I'd like to share some important information with you today to help you in your quest to feel good with fibromyalgia. One of the challenges that many of my patients have, at least when we first start working together, is that they have this condition called irritable bowel syndrome where, one day they're constipated and the next day they wish they were constipated because they have loose bowel movements. I find that irritable bowel syndrome is pretty easy to correct in my practice. And I want to give you some tips to help you if that's a challenge that you may have. So irritable bowel syndrome will cause an individual to either be one of three things. It's irritable bowel A, where you alternate between constipation and loose bowel movements, irritable bowel D, where you have loose bowel movements primarily, and then it can be irritable bowel C, which is constipation. And you could be any of those things, but when you have irritable bowel syndrome, you tend to have a lot of bloating and gas. It can be very uncomfortable, a lot of pain, a lot of stomach pain. If it's really severe, then you really have to be careful where you go out on a daily basis, because you might not know if you have to use the bathroom right away, and sometimes that can be embarrassing. But there's some common things that you can do that can greatly help this thing called irritable bowel syndrome. And one of those things is you can make sure if you're constipated that you're getting plenty of magnesium. So magnesium is a natural muscle relaxer. It relaxes your muscles, so it's great for fibromyalgia, but it also relaxes your colon. And if you're constipated, you get a lot of muscle cramps or eye twitches, start having things which would be a sign that you're deficient in magnesium, then what you want to do is make sure you're getting plenty of magnesium. My patients, I typically have them start with about 500 milligrams of magnesium a day, and preferably magnesium citrate, taurate, or sulfate, or glycinate, because you absorb it better, you tolerate it better, and won't bother your stomach. But once you get the right dose of magnesium, you should see that you'll have a normal bowel movement. Now, if you're the other way, if you have a lot of loose bowel movements, then one of the best things you can do is take a digestive enzyme. So taking a digestive enzyme will make sure that you're breaking down your food and helping you absorb it. And I like to use pancreatic enzymes. You can get those over the counter, and those do a real good job of helping you break down your food, making sure it's in a form that your body can then use it, so that you're not getting a lot of inflammation and having those loose bowel movements where you're having a dumping syndrome where the body just can't break that food down like it should. The other thing I recommend you do is that you take 5-HTP, which 5-HTP is an over-the-counter amino acid, 5-hydroxytryptophan, and 5-HTP raises your serotonin level. In fact, 5-HTP plus certain B vitamins, magnesium, and vitamin C is what makes serotonin. And the higher your serotonin level, the higher your pain threshold, so you have less pain, the happier you are because it's your happy hormone. But it also helps you regulate your bowel movements. It regulates your digestion. You have more serotonin receptors in your intestinal tract than you do in your brain. So when you get depleted in serotonin, as most people with fibromyalgia do, and that's why they have trouble with their sleep, have trouble with pain, have trouble with low moods and anxiety, but they also start having trouble with IBS. So if you're having a lot of loose bowel movements, or you're going back and forth, then I would encourage you to start taking 5-HTP.